Every year, thousands of retirees make a single Medicare mistake that adds a permanent penalty to their premiums for the rest of their lives. Not a one-time fee, a surcharge that compounds year after year, quietly draining more than $14,000 over a typical retirement. 42% of people approaching 65 don't even know they're at risk. It all comes down to a 7-month window most people have never heard of. The countdown to Medicare starts long before a retiree's 65th birthday. The initial enrollment period, known as the IEP, is a 7-month window that opens 3 months before the month you turn 65, includes your birthday month, and closes 3 months after. For someone born in August, the IEP stretches from May 1st through November 30th. This is not a random deadline. It is written directly into the federal Medicare statute and is the only period when you can sign up for Part B and Part D without risking a permanent penalty, unless you qualify for a special enrollment period tied to active employment coverage. Only those already receiving Social Security or railroad retirement benefits at least 4 months before turning 65 are enrolled without lifting a finger. In those cases, the Social Security Administration mails a Medicare card and coverage begins the first day of the birthday month. But the majority of future retirees, nearly 2/3, are not yet drawing Social Security at 65. For them, Medicare does not arrive by default. Instead, they receive a notice of eligibility and must actively file an application with the Social Security Administration, which processes all Medicare enrollments on behalf of the Centers for Medicare and Medicaid Services. Missing this 7-month window has consequences that last a lifetime. The law does not forgive late signups, and there are no do-overs. Even a short delay means higher premiums every month, year after year. The only way to avoid this trap is to mark the IEP on your calendar, confirm your eligibility, and complete the application before the window closes. Relying on employer coverage, COBRA, or family plans does not pause the Medicare clock unless the coverage meets strict federal definitions for active employment. Knowing your exact enrollment deadline is the first and most important step in protecting your retirement savings from unnecessary penalties. A missed enrollment window for Medicare Part B is not just a bureaucratic error, it is a financial penalty that follows retirees for life. The Centers for Medicare and Medicaid Services enforces a strict formula. For every full year you delay signing up after becoming eligible, the government adds 10% to your monthly Part B premium. In 2024, the standard Part B premium stands at $174 per month. That means a 1-year delay results in an extra $17.40 every month. For a 3-year delay, the penalty jumps to $52.20 each month, nearly a third more than the standard premium. This surcharge is not a one-time fee. It is permanent. Over a 20-year retirement, that $52.20 per month adds up to more than $12,500 in additional premiums. Even a single year's delay tacks on over $4,100 to the total cost of healthcare coverage. The penalty is based on the standard premium in effect when you finally enroll, so it rises as premiums increase in the future. For those who delay 5 years, the monthly penalty can exceed $87, pushing the lifetime excess above $20,000. There are no waivers for misunderstanding the rules or relying on employer communications that fail to explain the difference between active coverage and COBRA. The law is clear. The penalty is calculated using the 10% rule and is locked in for as long as you have Medicare Part B. This is not a rare problem. Each year, millions of new retirees face this risk, and thousands pay the price for a mistake that could have been avoided with a timely application. The numbers make the consequences real. Missing the enrollment window can quietly drain thousands from retirement savings, year after year. Maria spent her entire career as a nurse, guiding patients through complex medical systems. But when she retired at 65, she assumed Medicare would arrive automatically, just like her Social Security check. That assumption cost her dearly. Maria hadn't started collecting Social Security benefits before her birthday, so no Medicare card appeared in her mailbox. She missed her initial enrollment period without realizing it, and by the time she applied, a full 3 years had passed. That delay triggered a 30% permanent surcharge on her Part B premium, more than $50 extra every month, for the rest of her life. Maria's story is far from unusual. According to a national survey by the State Health Insurance Assistance Program, 42% of adults approaching Medicare age believe enrollment happens automatically. For thousands each year, that misunderstanding leads to penalties that quietly drain their retirement savings. A simple mistake, rooted in a widespread myth, can end up costing over $12,000 across a typical retirement. Linda retired from teaching at 65, confident her health coverage would bridge the gap to Medicare. Her school district offered COBRA, letting her keep the same medical benefits for 18 months. What Linda didn't realize is that COBRA, while it looks like employer insurance, is not considered creditable coverage for Medicare enrollment. The Centers for Medicare and Medicaid Services draw a firm line. Only active employment group plans count. COBRA is just a temporary extension, not a qualifying exception. Linda stayed on COBRA for over a year, believing she could enroll in Medicare when her continuation coverage ended. But by the time she applied, her initial enrollment period had closed months earlier. The law treated her as being uninsured for Medicare's purposes, and a 30% penalty was added to her Part B premium. In 2024, that meant paying an extra $52 every month, over $12,000 across a typical retirement. Linda's story is not rare. National surveys show that more than a third of adults mistakenly believe COBRA is creditable. This single misunderstanding can quietly drain thousands from retirement savings, all because the rules distinguish between active employment and continuation coverage. A 3-year delay in Medicare enrollment doesn't just create a personal setback, it adds up to a national problem. When you look at the numbers across millions of retirees, the cost is staggering. The standard penalty for waiting 3 years is a 30% increase on the monthly Part B premium. In 2024, that means paying an extra $52 every month. Over a typical 20-year retirement, this penalty alone totals about $12,500. But that's not the whole story. Most people who delay Part B also put off signing up for Part D prescription coverage, which carries its own permanent penalty. When you combine both surcharges, the lifetime excess reaches nearly $14,300 for a single retiree. Multiply that by the thousands who make this mistake each year, and the cost to retirees nationwide climbs into the billions. The penalty isn't a one-time fee, it's a permanent drain on savings, year after year, simply for missing a deadline most people never see coming. The Special Enrollment Period, or SEP, offers a crucial safety net for retirees who lose active employer health coverage after turning 65. Federal law gives anyone in this situation an 8-month window to sign up for Medicare Part B without penalty. The SEP begins the first month after employer or spousal coverage ends, not after COBRA or retiree insurance, but true active employment coverage. Missing this deadline means the standard late enrollment penalty kicks in, and the opportunity is lost for good. James, a senior engineer, learned this lesson the hard way. He retired at 67, thinking his wife's employer plan would protect him from Medicare penalties. When her job ended, James assumed he had plenty of time to enroll. In reality, his SEP clock started ticking the month after her coverage stopped. Distracted by paperwork and unclear HR emails, James waited nearly a year before applying for Medicare. By then, the SEP had closed. The government added a permanent surcharge to his Part B premium, an extra cost he will pay every month for the rest of his life. James's story is a reminder. The SEP is a one-time, 8-month window triggered by the end of true employer coverage. Missing it can turn a simple delay into a lifelong financial burden. Prescription drug coverage brings its own lifelong penalty. Medicare Part D enforces a strict rule. For every month you delay signing up without creditable drug coverage, the government adds 1% of the national base premium to your bill. In 2024, that's about 33 cents per month for each month missed. A full year's delay means paying an extra $4.68 every month on top of the plan's regular cost, for as long as you have Medicare drug coverage. These penalties stack with the Part B surcharge, quietly inflating healthcare costs for decades. Policy reform is finally catching up to the scope of this problem. The Centers for Medicare and Medicaid Services have proposed cutting late enrollment penalties by nearly half, projecting $2 billion in savings over 10 years. If adopted, these changes would ease the burden for future retirees and reduce the number of people trapped by permanent surcharges. Meanwhile, the State Health Insurance Assistance Program, known as SHIP, has shown that guidance makes a difference. Among those who receive full SHIP counseling before their enrollment deadline, 84% avoid any penalty at all. These numbers offer hope that with clearer rules and better outreach, the Medicare mistake can be prevented before it starts. Each year, confusion around Medicare enrollment rules leaves thousands facing unavoidable penalties, costs that never go away. With over 10,000 Americans turning 65 daily, the stakes have never been higher. Understanding the rules isn't just a precaution, it's protection for your future. Stay vigilant and share what you've learned.